we're going to share some data that, like I said, is some of the most bearish data I've seen in my career. But then we're going to give you the positives that you can do and the steps that you can take as an employer. I'm Taylor Rogers, by the way, with CCIG. I'm an advisor, working with employers to help craft solutions. First off, we have Connie Perry, and she is now the managing director for Ethica Pharmacy Advisors. So she is an independent pharmacy consultant working with large employers throughout the country, large and middle market. Next, we have Blake Allison. Blake is the CEO of Employer Health Network. Blake is a wealth of knowledge, both from the provider, the hospital side, as well as now from the employer side, working with self-funded plans. So prediction number one, we promised you two of them. We predict that trend is going to actually be greater than 9% for the year 2026. All of the things, like everything in our lives, are getting more expensive, and medical care is no different from that. So that's certainly a piece that's very relevant. What is driving this? We are getting older, and our youth are sicker than they've ever been and more expensive than they've ever been. We're seeing now double digits on both sides of the RX spectrum. The median cost of a new drug to market in 2023 was $300,000. That's up 35% from the year prior. PBM is one of the more complicated instruments in existence, and all of this shell game here that starts to happen, that's why you need someone like Connie, an independent PBM advisor that can keep their pulse on how the game is changing and make sure that you are not the victim of these things. But I did promise optimism. I did promise action items, and that's where we're going to go now. Number one, data-driven plan management. You can't improve what you can't measure. You need to know what's happening under the hood of your health plan. Next is high-performing network strategies.
We're also creating stability over time, and we're doing that in a couple different ways. One, we're very big on the steerage aspect of our network, so people get health care inside a machine that knows what it's doing and it's coordinating. Number two, though, really what's more interesting is our contracts are incredibly stable. These are meaningful partnerships.
The network's going to help me get to the right side of care so that I'm getting healthcare in the most efficient way possible. Then finally, PBM optimization. You can see these are the three big bricks.
We really recommend you look at pharmacy every single year. You want to look and see, okay, number one, how's the contract look? Is it stale? Is there room for improvement? You want to look at your plan design. How is it set up? Is it optimized?
If you have any follow-up questions, feel free to reach out to myself. I'm happy to connect you with Blake and Connie if you want to talk more with either of them, and we'll talk to you next time. Thank you.